Carlos Cubia, Walgreens Chief Diversity Officer. Great to have you on. Tell us about this partnership with Uber. How did it come about, and how does it actually work?
Well, thank you for having me, Jill. It's good to be with this morning. Yeah, we're super excited about the partnership with Uber. When we think about making sure that we get the vaccine as widely distributed as possible, especially in those underserved, underrepresented areas, we know that barriers exist to getting the vaccine. And one of those major barriers is transportation. How do people get to the location to get their shot? And then because there are two doses, how do they get back to get that second shot? So our partnership is with Uber in conjunction with other community partnerships is to provide 10 million free rides to our clinics. And so what will happen is once you make a appointment to get the vaccine, once it becomes widely available, you will also get a voucher or a notice to contact Uber to get a ride to the location so that you can get that shot.
Is there anything being done to make it easier to actually sign up for the vaccine? I personally have been trying for a member of my family who's high risk, and I consider myself pretty technology savvy, and I'm confused. So what is the process going to be like at Walgreens for if you do want to sign up for a shot there?
Well, so we're going to have a number of different ways you can sign up. Obviously, one is through our website, through mobile technology, through other digital technology. But for folks that are challenged in those areas and may not have access, you can contact our stores. We will be actually doing outreach through some of our pharmacists, through patients that we know that are vulnerable and need the vaccine. So you can contact the store directly. There'll be outreach from our stores and other outlets through Walgreens, in addition to maybe working with the community partners that we have announced and will continue to be announcing over the coming weeks and days and weeks, I should say.
So I know you're launching this program in Chicago, right?
Sure.
Why that city?
Well, that's our backyard. I mean, we're headquarters in Chicago, and we know that that is a very vulnerable area in terms of, for Black and Brown communities. So we figure we could make a difference in our backyard. So we're going to start there, but the plan is to scale this as much as possible in other underserved areas across the country. We have 4 areas that we have targeted right now. It's Atlanta, El Paso, Houston, and Chicago. But again, as I stated, we will be expanding this and scaling this across the country because we know this is important.
What is your expected timeline for when people, anybody could go into Walgreens and get a vaccine?
Sure, that's a great question. I can tell you right now, we are working with the CDC, state, federal, and local governments on the current guidelines that exist. But as we move to the next phase, we're hoping that we'll be able to start to open this up for wide and mass distribution, but it still is going to be contingent upon getting the approval from the federal government and the CDC. As we heard Dr. Fauci say on television about a week ago, we're thinking sometime in April we'll be closer to that next phase. But again, we're not making that decision. We're working with the authorities, and once we have that information, we'll make it available and open our doors to as many individuals as possible.
How else is Walgreens working to promote health equity? And do you think that this pandemic has opened people's eyes, or at least, the majority of the public, do you think it's opened their eyes to the inequalities that are in this healthcare system?
Yeah, well, one of the things the pandemic has done has really brought to the forefront the health disparity that has existed for so long in our communities. These are not new, and for Black and Brown individuals, we've always been aware of this. But to your point, it has opened the eyes and showed that the health disparities exist and the catastrophic impact it can have on our country and our nation if we don't address it. And one of the things that Walgreens is doing and continues to do is to make sure that we're paying attention to those underserved, medically underrepresented areas through going into those communities, educating and providing information on the efficacy of the vaccine, the safety of the vaccine, trying to dispel rumors around distrust and why people are not taking the vaccine, and then creating partnerships like the one we just talked about with Uber to make sure that we're hitting as wide a swath of the general public as possible. Because if we're ever going to get back to some sense of normalcy, this vaccine is important that we get out there.
How should health officials and public officials be trying to convince minority communities that this vaccine is safe? Because there is still so much skepticism.
Well, so we've stood up a vaccine equity task force within our organization to do three things, and I briefly touched on them. It's to educate those individuals in these areas on really why it's important that they take it. It's also getting individuals that they trust and influencers that have relationships with them. And that's why these community partnerships, for example, with the Chicago Urban League, we're working with the Chicago Urban League and we're talking to other urban leagues across the country at this point about utilizing their connections to educate the community. We're looking at influence, social media influence, and putting materials and information out there so people know what the vaccine can do for them, what the challenges of access are, and then overcoming those challenges.
All right, such an important topic. Thank you so much for coming on. Carlos Cubia, Walgreens Chief Diversity Officer. Great to have you on this morning. Appreciate it.